Welcome to Knowledgeable Aging. I'm your host, Jason Kotar. Joining us today to talk about diabetes and feet is Dr. Mark Hinkes. Dr. Mark Hinkes is president and CMO of ePrevenair, a company who offers a cloud-based tool for primary care providers to manage the 4 comorbidities of diabetes. Dr. Hinkes is a Doctor of Podiatric Medicine who recently retired from clinical care after 40 years service, 20 years in private practice in Miami, Florida, and 20 years at the Veterans Affairs Medical Centers. He is the author of 2 books on diabetic, foot health, Keep the Legs You Stand On, and Healthy Feet for People with Diabetes. How are you doing today, Dr. Hinkes?
Jason, we're doing great, and thanks for the opportunity to be with you and your guests today.
Very good. Looking forward to it. But before we get started, Dr. Hinkes, for those that are joining us today for the live webinar, if you have any questions, type your questions in. Time permitting, we will do everything in our power to get your questions answered. So Dr. Hinkes, I'm going to turn over to you. Diabetes and your feet.
Jason, thanks a lot, and good afternoon or good morning, depending on what time zone you're in. And it's my pleasure to be with people associated with Knowledgeable Aging to talk about diabetes and foot health. Today, I'm going to bring you both good news and bad news. So let's start with the bad news. The bad news is that people with diabetes do have increased risks associated to their feet for ulcers and amputations. Now for the good news. The good news is that with proper evaluation and management of your foot health, you'll keep the legs that you're standing on today and won't have to worry about any of the awful problems that we see in people with diabetes. So today we're going to look at the issues that affect the foot health of people with diabetes that could result in a diabetic foot ulcer, an infection that might require hospitalization, or in the worst case scenario, an amputation. We'll also look for highlights for opportunities to prevent things like this as we go through. So while most people with diabetes are aware of issues like chronically elevated blood sugars, there are other things that you need to know about. And one of the big ones is peripheral arterial disease and also behaviors. You know, what are you doing that's right? And perhaps what are you doing that isn't so right? And when we find out about that, we'll talk about that as well. So the 2 take-home messages that I'd like to share with you today are, number one, understanding how diabetes affects your feet will give you the power to prevent the awful complications of foot ulcers, infections, and needing to go to the hospital and amputations. And the second is, and probably really important, is being proactive instead of being reactive in your health is the key for people with diabetes to long, happy lives free from complications and problems with your eyes, your feet, your kidneys, and your cardiovascular system. So today's important topics that we'll talk about are a review of some of the statistics with diabetes. Where are we now? How does a person with diabetes end up with an amputation? A look at neuropathy and peripheral vascular disease and how these problems affect your feet. We're going to look at risk factors and other diagnoses that increase the chances of developing a foot ulcer that can lead to an amputation. We will also talk about patients' feelings about amputations. We'll briefly discuss the ABCs of prevention and the future of amputation prevention by personalized medicine, machine learning, and artificial intelligence. So we have a lot to cover in about 12 minutes. So why is there a picture of a stone crab on the screen here? Well, the stone crab is a gastronomic delicacy that's found off the coastal waters of the Gulf of Mexico off of the Florida coast. Its name refers to the hardness of the shell. It is like concrete, and I can testify to that. So if you want to eat some of the meat that comes out of the claws, you need a hammer and some significant elbow grease to crack that claw. Now, only one claw at a time is harvested, and this permits the crab to use the other claw to defend itself while it regrows the missing claw. And this is really an important point here because humans don't have the ability to regrow a missing toe, foot, or leg. So the lesson here is that your feet must last a lifetime. Let's talk a little bit about some statistics about diabetes in your feet. And what I want to say here is that long before the COVID pandemic was recognized, there was another pandemic, and it remains quite a bit unrecognized today. And that's the pandemic of the diabetic foot. Here are some statistics to think about that support this claim. There are over 1 billion people on this planet that are affected with diabetes. 500 million are diagnosed and 500 million are diagnosed as pre-diabetic. 15 to 25% of all these people will at some time have a foot ulcer. 85% of all non-traumatic lower extremity amputations in the diabetic population are preceded by a foot ulcer. A diabetic foot ulcer happens once every 1.2 seconds worldwide, and there are 1 million lower extremity amputations done at the rate of 1 every 20 seconds. After the initial amputation, 38% of the people who lose a leg will lose the other leg within 3 years, and 75% of the people who lose a leg will not be here in 5 years. So the mortality associated with a diabetic lower extremity amputation is greater than all forms of cancer combined, except for lung and pancreatic cancer. And 50%, there's a 50% recurrence rate for diabetic foot ulcers. Now, this is kind of a busy slide, and I'm going to take a minute here to go through it, but lower extremity amputations are the result of a complex set of predisposing conditions that are initially caused by chronically elevated blood sugars. And let's take a look here at the slide. Up here at the top, we have angiopathy. This is the vascular root. And over here, we have neuropathy. This is the neurological root. In the vascular root, we have large and small vessel disease. Excuse me. And large vessel disease usually happens with a clot in the leg, where the leg will turn black or gray. It will be acutely painful. You're going to know you're in deep trouble. And so you're going to probably get to the emergency room before gangrene shows. The small vessel disease is the hallmark of diabetes, and this is where you can have real problems, not only in the feet, but in the other sites, the eyes, the kidneys, and some of the other places where small vessels are located. But in the foot, we can get patchy areas of gangrene, which might require a minor amputation of a part of a toe or a toe. The other thing that can happen is we can have atrophic skin changes where your skin gets dry or cracks, which can lead to an ulcer that can become infected. And you may or may not get gangrene, but you'll end up with an amputation. On the neurological pathway, let me go back. On the excuse me, on the neurological pathway, we have autonomic sensory and motor neuropathy. Autonomic neuropathy causes dry skin, cracks and fissures due to decrease in perspiration, which leaves the skin open for an infection. Let's skip over to the motor portion of neuropathy, which causes muscle atrophy, changes in gait, and new pressure points, which can cause ulcers. And sensory neuropathy is the pathway where most people with diabetes end up getting an ulcer, and it kind of goes this way, where you have loss of sensation due to diabetic sensory neuropathy, and we have painless trauma. Mechanical, chemical, or thermal trauma causes an ulcer and an infection. The other pathway of sensory neuropathy causes bone changes where there are deformities in the foot, and you end up with what's called a Charcot foot. Nevertheless, whatever happens here, the ultimate result is that you lose your foot and maybe your leg. So now we're going to talk a little bit about diabetic neuropathy and ischemia. We know that chronically elevated blood sugars cause vascular and neurological changes in your feet, and the result is a feeling of burning, tingling, shooting, and eventually numbness to the foot. And these changes leave the foot vulnerable to developing an ulcer. How do we know if a person has sensory neuropathy? Well, we use what's called the Semmes-Weinstein monofilament. And briefly, the history on this is that the H.L. Tuber group in the late 1800s was using horsehair to check a patient's ability to sense touch when the horsehair touched the foot. It was kind of a gross way to do it and didn't really have much control. In the 1950s, two researchers for the Department of Veterans Affairs, Semmes and Weinstein, were commissioned to check the relationship between gunshot wounds to the head of soldiers and their ability to have sensation in their feet. And that's where most of the research came. Now, what happens here is the little wire is touched, and you can see on the left-hand side 3 or 4 circles. And depending who you talk to, some people require that this should be touched in 12 different places. But for our purposes, 4 is fine. And the idea here is we want to see if the patient can feel the wire. 19% of all foot ulcers happen on the big toe, 25% happen here, and about 25% happen here. So that's about 2/3 of all the foot ulcers are going to be in these three places, and that's why we're checking them. If you feel the ulcer, I mean, if you feel the wire, great. If you don't feel the wire, it's highly likely you have sensory neuropathy, and that will necessitate you changing your life a little bit and how you live to protect your foot. Pain, the gift nobody wants. This is a book that every person with diabetes should read. And this is the story of Dr. Paul Brand, an Englishman who was the son of missionaries that worked in India in leper colonies. And Brand ended up becoming an orthopedic surgeon, went back to England and got trained as a hand surgeon. And then he came back to India and he started working with the lepers. And he discovered that these people, because of their leprosy, could not feel pain. And he goes on to tell the story about how they would drink blistering hot tea that would burn the throat of any normal person, that these people couldn't feel the heat of it, and so they would burn their throat. And then he tells another story about how patients would come in one day and be fine, and then the next day they'd come in and part of their nose was missing. And everybody just decided that that was part of the leprosy, but Dr. Brand didn't think so. So he actually went into the dormitory where these people slept and sat up all night and kind of watched what happens. And to his chagrin, what he actually saw was that rats were coming and eating the noses of these people while they slept, and they didn't feel it. So Brand was able to identify the fact that the neuropathy that people with leprosy had was the same neuropathy that people with diabetes had. And it's a fascinating book, and I recommend anybody that's diabetic to please read this book. Now we're talking about peripheral arterial disease, and there's a lot to know about this. It's a really significant factor in amputations, and in many cases, if the arterial disease can be reversed by vascular surgery, wounds can be healed and legs can be saved. So not looking for peripheral vascular disease by your primary care doctor is a mistake. Blocked leg arteries are common, especially in people who smoke or have diabetes. And people that have this have high risk for heart attack, stroke, chronic kidney disease, and cancer. So people that also have blocked arteries have high cholesterol deposits, and which could rupture, cause a clot, cause a heart attack, and a stroke. So in some of the research that they've done, they looked at a cohort of 170,000 people who had a procedure to open a leg artery. And what they found was that 49% of the people smoked, 51% had diabetes, 80% had high blood pressure, and 70% had high cholesterol. So, you know, these are the factors that are going to cause your arteries to get blocked. And so, you know, take a word of advice. Don't smoke, you know, take care of your blood sugars, take care of your blood pressure, take care of your lipids. Now, on the slide here, we have the guidelines for testing. I'm certainly not going to go through them. You can look at them. But my thought here is every person with diabetes and a foot ulcer should have PAD testing. What are the risk factors for developing a diabetic foot ulcer? Well, there are a variety of them, and as you can see on the screen there, there's quite a few of them. And not everybody has every risk factor. So if any of those things look like you and you're diabetic, you should be taking steps to prevent any kind of trauma to your feet. Now, the other part of this is what are the other diagnoses or other health problems that you may have that will increase your risk for amputation? And there are a variety of them, and I'm just going to let you read them, so I don't have to read them for you. But recognize that if you have diabetes and have any of these other problems, you need to be very careful. When we talk about referral to the interdisciplinary team, one of the biggest mistakes primary care providers do is thinking that they can control what's going on with a patient with diabetes when in fact they can't. And oftentimes you'll see a primary care provider say to a patient that has an ulcer, well, it's just a small ulcer, let's put a little Neosporin on it and watch it. You know, nothing could be the worst thing. That's the guy that's going to lose his leg. So it's up to your primary care provider to figure out what your problems are and who can help you. And as you can see, there's quite a long list of people there that might be able to help you. Ulcer avoidance and patient feelings, this is something that most people, don't think about, but it's very telling because the research has found out is that, ulcer avoidance is a negative goal and people don't like that. It's associated with negative self-esteem, depression, and ineffective problem solving. Patients experience a lack of control, and part of that is because they have limited knowledge of why they have an ulcer and what the treatment options are. And then lots of times patients don't feel like they actually need to have anything done, which is, obviously a mistake. So patients have negative views on therapeutic footwear. And the bottom line on this whole situation is that patients feel burdened in preventing an ulcer while they're more comfortable in trying to treat an ulcer. So some people fear an amputation of a limb more than death. And diabetic foot disease is ranked in the top 10 of all medical conditions in Medicare discharge summaries. So prevention of foot ulcers and amputations is crucial to decrease both the costs to patient, the society, and the healthcare systems. So if anyone would ask me, what should I do about my diabetes and how can I keep myself healthy and prevent ulcers and amputations, I'd respond with the following. Keep your blood sugars under control. There is nothing more important than that. And now we have 21st century technology with continuing glucose monitors, and Samsung just came out yesterday in a news brief saying they've developed a method to identify your blood sugar by using a laser, so no more finger sticks at all. So keeping blood sugar under control is the most important thing. And don't kid yourself. There are people who are in denial who say, no matter what I do, I mean, people in resignation who say, no matter what I do, I'm going to have a problem. And there are people in denial saying, even if I do it, I'm going to have a problem. So, don't be on either side of that either end of that gray rainbow. Get in the middle and take care of yourself. So control your blood pressure. I have blood pressure problems. I take my medicine. My blood pressure is perfect. Control your lipids, your cholesterol and triglycerides. Diet is the major thing that you have to watch out for. And so you want to be very careful about what you eat. Exercise is a really, really important part of staying healthy. So if you walk or swim or bike or whatever you want to do, but just get out and do it every day. And professional foot care for foot health. So we don't want you being a bathroom surgeon. Don't pick up, whatever's in your bathroom, scissors, razor blades, nail clippers and things. Just, don't do that. Get professional foot care. And then finally, you want to avoid smoking and vaping. So if we would make a Nike commercial for this topic, we would say, just don't do it. So let's talk about the future of amputation prevention. And the future is going to be involved in personalized medicine. And a majority of the opportunity in diabetic foot health is to prevent foot ulcers and amputations by using personalized medicine. And personalized medicine identifies each person's unique risk factors for developing an ulcer by understanding and using the findings in the history and the physical exam. Personalized medicine may be characterized by providing the right treatment at the right time for the right patient. It helps us to organize the information from the history and physical exam, and it helps your doctor to decide on future treatment options. There are classical risk factors, which are neuropathy and PAD, which almost everybody with diabetes has. And then there are modifiable risk factors, which are bone, soft tissue, and nail deformities and biomechanical problems. And biomechanics is the study of understanding how we function, how our gait cycle is, and how we function. So when we figure out what's going on, we can identify those specific risk factors, and we can modify the ones that we're able to, and we can prevent a lot of problems by doing that. And then finally, the future of amputation prevention is going to be in machine learning and artificial intelligence. And this is very, very exciting. The future of prevention and management of the comorbidities in diabetes is going to be in data. And that is, we're going to collect enough information of data so the computers can begin to develop an understanding about each of the 4 comorbidities of diabetes the eyes, the kidneys, the circulatory system, and the feet. And by doing this, we'll be able to develop what's called predictive capabilities concerning each of the comorbidities. And even further, once we develop predictive analytics for each of the individual comorbidities, we'll be able to fuse data across the 4 comorbidities. So if you come in for an eye exam, we'll likely be able to tell you about your foot. Or if you're coming in for a foot exam, we'll likely be able to tell you about your kidneys. So this is very, very, very exciting area for the future of diabetes and the future of health in general. So in closing, I'd like to recap and just say, today we reviewed a variety of factors that affect your foot health, and the focus has been on preventing ulcers and amputations. My hope for you is that when you return to your next doctor visit, you share your concern about your foot health and ask for a foot evaluation to identify and ameliorate any of the risk factors for developing an ulcer and discuss options for prevention. Please remember that preventing the foot ulcer and infection prevents the hospitalization and the amputation. Thanks so much for your time. I hope you got something, a nugget or two out of the presentation.
At what age should individuals get serious about getting examined for indications of type 2 diabetes?
As soon as they are diagnosed. And that can be, if you have a family history of this, you really should be paying attention to it. But if you develop the signs and symptoms of diabetes, excessive thirst, excessive urination, wounds that don't heal well or in a timely manner, sleep problems, eating problems, all the things that are associated with diabetes, you should be going to your doctor and asking to be tested for diabetes.
Is there any direct connection between obesity and type 2 diabetes?
Jason, that's a fabulous question. And there absolutely is a direct connection. And I will refer whoever asked that question to a book called Diabesity. And in that book, they specifically talk about the direct relationship between obesity and diabetes. Yeah, I mean, what tends to happen is, people eat, they drink sugar beverages, they eat candy, they eat carbs, they overload with carbs, and they actually burn out their pancreas. And so they start to become either type 1 at that point because the pancreas is not functioning, not making any insulin at all, or they become type 2 where the pancreas only makes a limited amount or the amount that it makes is not sufficient. And so the people need to go on medication. So this obesity issue is really, really a tough one. There are psychological issues relative to it, and there's a group with a product called Noom, Noom, I think is what it's called, and they have kind of factored in the psychological issues of diet so as to help people lose weight and keep the weight off.
Noom, Noom.
Yep.
Got it. Questions keep coming, Dr. Hinkes. Is a diabetic blister the same as a diabetic ulcer?
Well, I think what we need to say is a blister the same as an ulcer? And not exactly, but I will say that they share one thing in common, and that is that they represent a break in the skin. Now, a blister is kind of more superficial because the skin underneath it is pretty well intact, whereas an ulcer is not that way. It can go much deeper through the epidermis, the dermis, and into, and maybe even below the superficial fascia. And tendons and joints can be exposed in ulcers, and so they are different. A blister is kind of like a tap on the hand. An ulcer is a good smack in the face.
Okay. What foods are particularly beneficial for type 2 diabetes prevention or management?
I would say that whoever asked that question really would benefit from seeing a diabetes educator or a nutritionist. Now, clearly, there's lots of information on the web that anybody could find to try to answer this question. But the trick with diabetes is to minimize the amount of carbs that you eat, because carbs get turned into fat, and then or they increase your blood sugar. So managing carbohydrate foods is really critical to maintaining a good blood sugar level.
Are there vitamins recommended for blood circulation, Dr. Hinkes?
Vitamins for blood circulation. Well, I think that the issue with circulation is trying to be sure that your arteries don't get clogged with cholesterol and triglycerides and plaque. So, those kind of foods that are high in cholesterol and high in triglycerides are the ones that are going to um, gunk up. That's a scientific term, isn't it? Gunk up your arteries. So, I don't, off the top of my head, I don't know any foods that are going to clean out your arteries. But I think the better approach is, don't eat the things that are going to give you problems with your arteries.
Yeah. Is it okay for a diabetic to get a pedicure?
An excellent question. No, well, I'm going to say yes and no. Yes, if you can't see your feet, you can't reach your feet, you don't have the right equipment, the right lighting, you don't have good eye motor coordination, then you need someone to take care of your feet, corns, calluses, and nails. But having said that, you just don't want to go to anybody. You want to go to somebody that's got a education and training as a master pedicurist, or that has special training to give what they call a medical pedicure. And there are more and more people that are getting this kind of training. And there are a lot of people in this country that are called foot care nurses. And a lot of people with diabetes are not aware of foot care nurses and the opportunities that they have, but they absolutely can take care of these problems very nicely. Podiatry can take care of these problems as well. I would really not want to go to, your local pedicure, that has Enya playing and the waterfall and all that. You want to be certain that where you go, the instruments are steam sterilized, individually bagged, and autoclaved. If you get to your little pedicure station and your instruments don't come out of a steamed autoclave bag, get up and leave, because the chances of developing hepatitis or HIV or any other kind of infection are high because the instruments are not clean and sterile. That also goes for the little foot bath. If they don't have a little plastic liner in the foot bath, don't put your feet in there.
Yeah. Regarding baths, so along the lines of soaking your feet, somebody asked about Epsom salt. Is that recommended?
I like vinegar, actually, because Epsom salts can be really, really drying. And the reason I like vinegar is that it's a little bit of an astringent, but it also changes the pH of the water and makes it a little bit more acidic. And that will prevent getting a mold, yeast, or fungus infection that is associated with the chronic moisture of soaking.
Should diabetics wear socks to bed at night?
That's another good question. If your feet are cold, yes. If your feet aren't cold, no.
Okay. What should somebody use to moisturize their feet? Like Vaseline, etc.
That's another really good question. The best chemical that I know to use to moisturize feet is a chemical called urea, U-R-E-A, urea. Vaseline Intensive Care and Gold Bond and all these other, and I'm not singling out any products in particular, I'm just saying products that do not contain urea work on the premise that we're going to seal in the moisture. Vaseline, for example, we're going to seal in the moisture. But if the skin is already dry, there's nothing there to seal in. Now, this chemical urea has the property that it brings moisture from the deep tissues to the superficial tissues. So that's why I like this product a lot, and that's why I recommend it.
Very good. Dr. Hinkes, how can people find you?
Well, down at the bottom of the slide there is my email and my LinkedIn address. And you won't see my picture in the post office. No, you won't.
If you don't mind, Dr. Hinkes, for those that'll be listening on our podcast a little bit later, can you tell us what your email is, please?
Okay, sure. drhinkes@gmail.com, drhinkes@gmail.com. And my LinkedIn address is Dr. Mark Hinkes, DPM.
Very good. Well, thank you again, Dr. Hinkes. Wonderful information. As far as Knowledgeable Aging, you can go to our website, knowledgeableaging.com. You can see all of our upcoming and archive webinars. You can go to our YouTube page, type in Knowledgeable Aging. We encourage you to subscribe. We update as much as we can. If podcasts are your thing, you can find us on Apple Tunes, Spotify, etc. Till next time, I'm your host, Jason Kotar, and this is Knowledgeable Aging.